Well, welcome to the Aging Boomers. I'm your host, Frank Sampson, and of course on this show, as many of you know, we discuss many of the issues facing boomers, their parents, other loved ones, and what of course we know is an aging population today. So very excited about our guest, our guest, and certainly the subject matter we're going to be talking about on the technology side with helping caregivers. So it's going to be a very informative show. So, and I want to let everybody know that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care management organization that has a national network of advisors to help in determining the right path for seniors in receiving proper care and even supervision. So whether it's in-home care, assisted living, residential, or memory care, get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231. Or you could go to right online at www.seniorcareauthority.com. And I want to just thank everybody. I really try to thank everybody on each show for tuning in. I mean, many of you, there's a lot of different ways to tune in. Some of you gone to iTunes, iHeartRadio, right to our website, downloaded a free app on your iPhone or Android phone. You just have to type in Aging Boomers, and then you'll get each show. And we do 2 a week. We usually do it on Mondays and Fridays. Sometimes those days don't work out, so today is one of those days. And anyway, I'm very, very thrilled to introduce our guest today. Her name is Christina Irving. Christina is a licensed clinical social worker at Family Caregiver Alliance in San Francisco. She received her Master of Social Work degree from San Jose State University. She has been a family consultant with Family Caregivers for the past 8 years, conducting in-home caregiver assessments, teaching classes, making presentations on topics which include understanding dementia and self-care, and providing individual supportive counseling to family caregivers in their various caregiving roles. She is also a trainer with the National Veteran Caregiver Support Training Program, co-leading classes for caregivers of veterans across the country. So I want to welcome Christina. Thank you for joining us on the Aging Boomers.
Thank you, Frank.
Yeah, it's just great to have you. And we're going to be talking about something that's, I guess, near and dear to my heart, and that's just all this innovative technology that's available to caregivers out there, and it's growing at a rampant pace. But before we do, I'd like you to just tell us more about the organization you're with, Family Caregiver Alliance. I know it's a national organization, even though you're based at the local office in San Francisco. So tell us a little bit more about the organization.
Sure. Family Caregiver Alliance was actually founded back in 1977, and we do work both nationally and locally. At the national level, we focus on policy and advocacy, trying to improve services and supports for family caregivers across the country. We also take calls from caregivers to help them locate resources in their state. And then on our website, we have a Family Care Navigator, which does help identify different resources supporting caregivers and older adults in their state, no matter where they live. And then at the local level, most of my work, as you said in the introduction, is doing assessments with family caregivers, helping them figure out how do you take care of yourself as well as your loved one, how do you figure out the resources, where do you go, how do you start. And then we do a lot of classes and education programs, both in person in the local San Francisco area, as well as online webinars, fact sheets, and then the trainings for caregivers of veterans across the country.
Great. So, and I'll ask you this again in case people are listening and don't have that paper and pencil in front of them. But what's your website? How would they get more information about the organization?
Our website is www.caregiver.org, and they can also always call our 800 number, which is 800-445-8106. Great.
And I'll ask you again at the end of the show so people can make a note of it. So, there can be so much stress and challenges, I know, that come with caregiving. I know you mentioned before caregivers need to take care of themselves too. Mm-hmm. So, how can some of this technology help not only the seniors that caregivers are taking care of, but the caregivers themselves? Can you kind of give us a big picture of all this?
Sure. There's lots of different ways technology can be useful, and you can kind of think about it as technology that does support the person needing care, and then technology that supports the caregiver. And the things that support the person needing care, obviously that helps the caregiver as well. But some of it is really related to the direct care of the person, so the personal care issues that they're needing help with. Some of it is more around kind of home safety and security issues. There's also technology that helps provide kind of emotional support and connection to the caregivers, so helping them connect with other caregivers, helping them coordinate care with other family members or with friends. So it really covers different domains. So technology that helps with the actual physical care of the individual needing help, the safety issues, coordinating care and managing tasks, and then providing that emotional and support to the caregiver to help them manage their own self-care needs.
So we'll get into maybe some of the more specifics, and I know doing a podcast, it's probably easier if we were on video and can show people, but I think we'll give people a pretty good idea of maybe some of the specifics. But this new technology for caregivers, and seniors, older adults, is growing so rapidly and evolving all the time. I'm in the industry, and it's tough to keep up with it. How does a family caregiver keep up with everything, coming out, and how is he or she able to really know what is best out there? I mean, a new product could come out and sounds good and everything, and the family makes an investment in that technology. How do they check really to make sure everything works well?
I think that is the biggest challenge right now, because this is a constantly evolving field, and a lot of these companies haven't been around for a long time. So you can't use kind of those old standards of how long have they had been in business and what's their reputation, because they may not have been in business for a long time. Right. And that doesn't necessarily mean that it's not a good product or a good service that they're offering. But we don't have some of those old standards for kind of evaluating these products. So a lot of it, we encourage people right now, talk to other caregivers, talk to professionals in the field, find out what they have used, what people have tried. And then it's really also looking at what these different technologies and products offer. Because some of the issue is not whether this one is a good product, but whether it's good for you. There are so many similarities across different caregiving situations, but there are also differences, and so it's really important to know what's going to work best for you. It may be a great product, a great service for somebody else. So if it's not actually going to help you and give you the support and assistance that you need, then it doesn't really matter how great or innovative of the technology it is, it's not going to be useful. So I think somewhat starting there for caregivers, really to identify what are the areas that they need more help. Where are things stressful for them or challenging for them, and really having a good idea of what it is that technology could do for them. So even if you don't know what product or what technologies are out there, just starting with, what do I need? What's going to make my life a little bit easier? What are the challenges I'm facing right now? And then going from there, because that's really what you're going to have to use to evaluate, is this helpful? Unfortunately, right now, there's not one repository of all the technologies that are out there, so it is a lot of just searching, talking to other people, doing web searches. There are some good websites that have a number of different examples of information, and that's really kind of the best you can do right now in terms of getting a list of what's available, is here are some examples, because it will constantly change, and there will be new things that will come up. So a couple of the places for people to know that have a good kind of repository as much as possible, or at least more detailed information about what's available. There's an organization called the Center for Technology and Aging that has some great information online. There's another group called the Tech Enhanced Life that has some great listings of technologies and products. Family Caregiver Alliance's website, we have some fact sheets and webinars based on technology and caregiving. So there are some good places that you can find information, but just knowing that none of those are going to have every type of technology that is out there, because there will be something new that will come out next week.
Yeah. I mean, I know, nowadays, I know even with my kids, I mean, we're talking about going out to eat, and we name a restaurant, and what do first? They go on to Yelp or another site on their phone and get the ratings and make sure, don't go anywhere without some evaluation ahead of time. And, you could go on other websites, order a product, and you read the ratings, the stars, etc. So it's still too early for that, or is that something your organization is maybe hoping to do, where people could actually give their own ratings of what the technology that they tried out?
It's definitely too early right now to actually see that. I know that's an area that we're looking at, and again, these other agencies that I mentioned have a little bit of that, but nobody right now has a Yelp for technology and caregiving. There is no one place for review sites. So it is really looking at them carefully, looking at the detailed information about them, evaluating it based on your needs, how the product works, and then cost issues. And then also talking, again, to other people. I think the more caregivers connect with other caregivers, with service providers and support systems out there, the easier it is, because this technology is so new. It hasn't been used by a lot of people, but when it is used, people do talk about it. So you may not have used it, you may not know somebody, but the social worker at the hospital or somebody at the caregiver support group, they might either have used it themselves or know somebody who has. So the more people talk about it, the more you will get some of that feedback, but there's just unfortunately no Yelp right now for it.
Yeah. So I know we're kind of talking big picture, not getting into too many specifics. Earlier you mentioned, technology for care coordination, task management. There's also, health monitoring, emotional support, all that. Can you give us some examples of more specifics so our listeners can understand a little bit better about specifically what are some examples of some of the technology out there?
Yeah, absolutely. So when we talk about like care coordination or managing tasks, I think a couple of the sites that have been around the longest and really started as websites, but now, of course, have mobile apps as well. Lots of Helping Hands is one that is commonly used, as well as Caring Bridge. Those two are great sites to invite family and friends to kind of join around the person that you're caring for, to be able to have a calendar where you can designate different tasks that need to be accomplished and allow people to sign up for them. So they're a way to kind of broaden your support circle a little bit and really engage those family and friends that may be around and offering, let me know if I can do anything, but not really doing anything. So it's a way to help out, whether it's people who want to be involved but live farther away, or people who live locally but just need a little bit more help. They're pretty easy to use and fairly straightforward, but then there are some other examples that get even more detailed. So there's another site called Cozy, and it's COZI, which again is web-based but much more app-based. And it really gets into tracking, was a medication given, being able to have a shopping list that is shared. So depending on, who's going to go to the grocery store for mom, different people can log in and see this is what's needed that day. It lets you track, again, kind of appointments and have people kind of sign up or have different tasks designated to different family members that are involved. So it gets a lot more detailed, and it's really a way to engage and kind of use the different people that may be involved in your loved one's life, so that it doesn't just fall on one person to be the primary caregiver. So those are some of the examples of the care coordination. When we get into more of the health management, I think the ones that people think of most frequently are the Fitbits or the Jawbones that, really track your steps and, manage your health in that way. There is a move in some way to do more of that healthcare monitoring, and there are some physicians, and particularly we'll see it in rural areas, that do use telehealth, where doctors are able to monitor blood pressure and blood glucose levels, where you can be transmitting that information with your doctor when you can't easily get into appointments. But I think for just caregivers to use and kind of purchase on just on their own, there's a lot of medication management systems. Some of those, again, are just apps, things like MedCoach, where you can put in what medications are needed, and it will give you those reminders on your phone. It's time for this dose. It's time for this dose. You're almost out of this medication. You need to refill it. Right. Down to actual pill boxes that have alarms on them, that will make a noise when it's time to take a medication, that will lock if you haven't taken that medication within a certain time period, so that you can't double dose or take medications too close together. To some pill boxes that will actually send an alert to someone's phone or an email saying, yes, this, the pills from this this particular time were taken out. They were taken out of the pill box. So it doesn't necessarily say, yes, they were absolutely taken by the person, but the pill box was activated at a particular time, so they can get very detailed in that way. Mm-hmm. In terms of caregivers being able to connect and get that emotional support, there are a number of online support groups. We have one. The Alzheimer's Association has one. There's a number of other places where you can connect with other caregivers, with people who understand what you're going through. We see more and more there being Facebook groups for caregivers around specific diseases or health conditions. So those can be great ways for caregivers to get that support when you can't get out to a support group. There are apps for meditation and relaxation exercises. So when people say, I don't have time, or I don't remember, I don't think about it, I don't know how to do it, there are apps. There's one called Breathe to Relax that just kind of takes you through some guided breathing exercises. And that can be great for caregivers. We know things like meditation and mindfulness are so helpful in managing stress and in helping with mood. So finding just those simple apps or websites that can help you do that really can make a difference, because they're easy for caregivers to do. We know their time is really stretched. They don't have a lot of free time. So when you can pull something out and you can do on your phone for 5 minutes, that's a great way to do it. Calm.com, so CALM.com, has both an app and online, again, some guided relaxation exercises for caregivers. So that can be really helpful for them managing their own kind of mental health and their mood, and getting that support that way.
That's just a wealth of information. Thank you. That's great. So, one thing I wanted to, make sure people listening to this, I believe that the technology isn't necessarily set up to replace a caregiver. It's more to support a caregiver. Would you say that, or is there some situations that it really can replace a caregiver?
I think really right now it's supporting a caregiver. Every once in a while you'll see an article online about robots replacing caregivers or what can they do. And right now we're not there, and we know there's so much that people gain from that person-to-person contact. So the person needing care and support really benefits from having these people who care about them and want to support them in their life. Even just the touch, how much touch does for somebody and how calming that can be. And for caregivers, we don't want technology to replace getting out, connecting with caregivers, getting exercise. It's really, again, to help support you doing that. When you can't get out so easily, here's an online support group. When you're having difficulty communicating and coordinating with your family, here's a way that can help you do that. It's really to help support the system that's already in place as opposed to taking over for it. Even the more high-tech technology of kind of the home safety monitoring services, where it may be webcam, but it may just be sensors that are monitoring the home and letting you know whether somebody opened the refrigerator that day or they've walked out their front door. Those don't replace the need for a caregiver of some kind. They just provide more information, maybe give the caregiver a little bit more time off so they don't always feel tethered to the home, or even just kind of help with some of that worry and that concern of, well, my mom's kind of doing okay, but she needs a little bit of help. I don't know if anyone would be aware if she fell for 2 or 3 days. I just want to have a little bit more sense of security that she's doing okay. Things like the home safety centers can help with that. So again, it doesn't replace the need for there being a caregiver, but it just may help them monitor that safety and ease some of those worries and concerns.
How do you feel about some of the, professional in-home care companies who are, hired by families and they're being paid an hourly amount for a caregiver to come in? How do you feel about them using some of this technology? Or do you think that the technology is geared more for family caregiving?
I think it's both. And they often work in tandem. One, we know there are some seniors and people with disabilities who don't have family, who really don't have a big support system. So they may be relying more on professional caregivers and in-home help or case managers. And so the technology can help somebody live a little bit more independently, so maybe they don't need as much help as they would if they didn't have any technology in place. But it can also help those case managers or home care workers better support that senior or that person with a disability. So it can be used in both ways. I think it can be helpful for families and it can be helpful for the paid and professional caregivers. And we know that many families will hire in-home help or will use a case manager because it often is more than one caregiver can do on their own. And they need to get breaks and they need to get time away. So sometimes these tools are actually useful in helping coordinate not just between a caregiver and their other family members, but between a caregiver and these paid professionals who are involved. Because we know that paying for in-home help or hiring a case manager is really only effective when there's good communication, when information is shared regularly and it's very clear this is what needs to get done today, this is what mom or dad's care needs are. That information needs to be shared regularly, so the technology can actually help with that.
Right. Well, this is great information. Maybe what you could do, because we only have a couple minutes left, unfortunately, I could talk to you all day about this stuff, but any advice that you could give to our listeners who are confronted with caring for a parent, spouse, or other loved one right now? I mean, it's happening right now, and just any overall advice, words of wisdom that you could give to them?
I would say the biggest thing is to reach out for help and do it earlier than you think you need to. You don't have to wait until you're overwhelmed or stressed out. It doesn't have to be farther along in the process. It's never too early to say, I'm concerned about this person in my life. They're starting to need more care, and I definitely see myself starting to move into this role of caregiver. What should I do? Where should I start? We don't learn about this growing up, so there's no expectation that you're going to know everything at the beginning. So reaching out, asking for help, talking to other people, when you're in it every day, it's really hard to look at what is the technology, what are the services in the community, what are the resources that might help me. So reaching out to support systems to help kind of assess what your situation is. What do you need? They're the ones who are going to really help you figure out, this is what's available, this is what's going to be most useful to me. Because when you're in it, kind of doing it day to day, you're just getting through it the best you can. So reaching out for that support, that help, those are the people who are going to say, this is where the adult day programs are, this is the in-home help, this is the technology that's out there. So getting that support and that advice from other people, especially around the technology because it is so new, talking about it, asking about it, I think is really what's going to help you figure out what's available. But it's never too early, never too soon to say, I need a little bit more support or information.
Great advice. Great advice. So tell us again how people can contact your organization, Family Caregiver Alliance, and again, whatever contact information you could provide, that'd be great.
Sure. So again, our 800 number, it's 800-445-8106. But I would definitely encourage people to take a look at our website, www.caregiver.org. We have more information and recent webinars on technology, as well as 70 different fact sheets, articles, and online support groups. So there's more detailed information on some of the things that we talked about today, as well as how do you find support and resources where you live.
Great. Well, Christina Irving, Family Caregiver Alliance, thank you so much for joining us. It was just a wealth of information, and I'm glad people can listen to this again because maybe they didn't get all those websites that you brought up. So that's great, and I just appreciate your time and really an open invitation to come back. I'm sure you're going to be in tune with some new technologies that come about over the next months and years, and we'd love to learn more about it. So we'd love to have you back in the future, and thank you so much.
Thank you.
You're very welcome. Thank you again, everybody, for joining us. Again, share these podcasts with friends and family. Get the word out. A lot of good information. Be safe out there, and we'll talk to you all soon.